We begin with Canada's effort to vaccinate as many eligible people as possible. As of today, 66 million doses arrived in this country. That's enough to give 2 doses to everyone over the age of 12. So far, roughly 80% of the eligible population has received 1 dose. More than 64% is fully vaccinated. Now, how do governments reach the 6 million Canadians who have not had a shot? Anita Anand is the Minister of Public Services and Procurement. She's in Oakville. Minister, thank you very much for joining us today. I'd like to jump right in and ask you about, you've reached one major milestone, getting enough COVID vaccine doses into the country, but there's still another challenge ahead. There's roughly 6 million eligible Canadians who are not vaccinated. What is your government actively doing to try and encourage the hesitant to get shots?
Well, thanks for having me on, Katie. And as you mentioned, this is an important day for us as we've reached the milestone of having 66 million vaccines in the country, which is enough for all eligible Canadians to be vaccinated. So the supply is here. And as you suggest in your questions, we do have more road to travel to ensure that all Canadians actually do step up and get their shots if they're eligible to do so. So we're working closely with the Public Health Agency of Canada, who are working with the provinces as well to make sure that whatever is needed in terms of support to the provinces, because of course they constitutionally have jurisdiction over the administration of healthcare, that we are there to support them in any way possible.
In the United States, the advice from the Centers for Disease Control, what we've seen, Centers for Disease Control has been, listen to the advice of your local, whether it's local religious leaders, local doctor, or friends or family, community leaders trying to step up and have those one-on-one conversations. Is that really all people can do at this point in terms of trying to convince people to get vaccinated? Is there anything else that can be done, really?
Well, I think you have to remember that the choice to be vaccinated is an individual decision. And so we have seen Canadians step up in record numbers. 80% of eligible Canadians have had at least 1 dose. 64% of eligible Canadians have been fully vaxxed. And so we are making very good progress at the current time. We are leading the G7 and G20. We have been at the top of the list of countries for 1 dose vaccinations for some time now. And we are now leading all other jurisdictions in terms of 2 doses. So we are doing well. We need to keep going. And my job as procurement minister is to make sure we have the supply, and that's the milestone that we've reached today.
As you mentioned, numbers are largely in a much better place now than they have been in the previous weeks and previous months. But even so, we've sort of talked about this. The work is not done yet. There's still a ways to go before, Canada is out of the woods. Is the government bracing for a 4th wave are you bracing for a 4th wave, and are you concerned that the unvaccinated could trigger that 4th wave?
Well, what I have done as procurement minister is to make sure that we have the supply of PPE that is necessary, as well as the supply of vaccines and rapid tests and other supplies in the country in case we do have a 4th wave. So, for example, on the PPE front, I and my department procured 2.7 billion items of PPE to account for the possibility of a 2nd, 3rd, or 4th wave. We've received over 1.5 billion items of PPE, gloves, gowns, masks, surgical masks, N95 respirators to make sure we are there for the provinces and territories, and especially frontline healthcare workers if we are into a 4th wave. In fact, we have so much PPE that we have procured additional warehouse space so that we will be ready if any such thing would befall Canada.
Okay, so you've got the gear, but are you bracing for a 4th wave? Do you expect that Canadians will have to endure that?
Listen, we are not out of the woods yet. Yes, case count have come down, but we are still making sure that we should be following public health guidelines, wearing masks in public places, staying home when possible. This is still recommended by public health authorities, and we still need to be very vigilant while we are trying to emerge from this pandemic. A fourth wave is possible, of course, and we will be ready at Procurement and the Government of Canada with PPE, with vaccines, with supplies to administer vaccines, as well as rapid tests, so that the Canadian public has the supplies it needs to fight any eventuality.
The big picture context, when you take a step back and you look at it, vaccine uptake in Canada has been far more successful than it has been in some parts of the United States, where there are massive challenges there. The United States 4 or 5 weeks ago was averaging about 10,000 new COVID cases a day. They're now averaging about 57,000 new COVID cases a day. Are you watching that and concerned if those last 6 million Canadians, or even if that number is reduced, that what you're seeing play out in the United States could also play out in Canada?
Of course, we are continually watching the case count numbers across the country, and coterminous with that, making sure that Canadians know that the supply of vaccines is available. And so, yes, we're watching the US and all other jurisdictions, but what we're also doing is making sure we have the long term in mind as well. And so, as Procurement Minister, I'm not only focused on making sure we have supply in the country now, but in the future as well, in case we need doses for booster shots, in case we need yearly vaccines. We have signed a contract with Pfizer, for example, to ensure that we have 65 million doses of vaccine available to Canada once Health Canada authorization is forthcoming for any Pfizer-related vaccine. So I want Canadians to know that we have planned for the short term as well as the long term. We have supply available in case the 12 and unders are going to be vaccinated. We have supply available in case a booster is required, and we have supply available in case this becomes a yearly inoculation. That has been the work at Procurement since day one, and we will continue to make sure vaccines are available for Canada at any time, any place.
And for right now, those are two hypotheticals down the future. I know that research is being done right now if they're going to expand eligibility for the under 12s, as well as, whether Canadians or people around the world are going to need a third booster shot. But you said that, Canada expects to have somewhere in the range of 95 million doses of Pfizer and Moderna by the end of September. If those categories are not expanded and Canada's just sitting on those doses, should Canada instead be donating those doses to countries in need as long as there is no increased uptake or increased need in Canada?
So to be clear, just to flesh out the number that you put forward of 95 million mRNA doses before the end of September. That number is broken down in terms of our contracts. We have 51 million doses on order from Pfizer and 44 million doses on order from Moderna. And indeed, that is important because we don't know as of yet what we will need in terms of boosters and for the other age groups that may need to have vaccines. So we are watching it very carefully. At the same time, we are maintaining our commitment to the developing world, and we will continue to do so. Recently, we announced 17.7 million AstraZeneca doses would be sent to COVAX for the developing world. In addition, the Prime Minister at the G7 announced 13 million doses would be going as well. So that's over 30 million doses to the developing world through COVAX. We've contributed over $500 million to the COVAX facility, and our Minister of International Development, of course, Karina Gould, is playing a pivotal role in the governance of that institution. So we've got two tracks going here: one, providing for Canadians, and two, at the same time, making sure we're fulfilling our commitment to the developing world, because we know that until everyone is safe, no one is safe.
We're also curious about the J&J vaccine. Canada had ordered some 10 million doses of the one-shot vaccine. What is the latest on the status of that order, and what is Canada going to do with those?
Well, it's a very good question. We're still in communication with J&J and have been all along, as we do have a contract for 10 million doses of that vaccine. That contract is still in good standing, and we are waiting for J&J to tell us what is next in terms of deliveries for Canada. J&J has had some concerns with its emergent plant in Baltimore, and that did affect Canadian deliveries and deliveries all over the world. But thankfully, because we have a diversified portfolio of vaccines, we've been able to service Canadians' need for vaccines through our multiple different contracts, whether it's Moderna, whether it's Pfizer, et cetera. So we will continue to make sure that Canadians have access to vaccines.
I was going to say, do you even need it anymore because you've got so much of the mRNA vaccine?
It's a great question. We have heard from the provinces that the demand isn't there for J&J vaccines. So we really are taking the cue from the provinces in terms of what they want to administer. Because I want to remind Canadians that we at the federal government are really filling what the provinces and territories are telling us they need. And right now, they have told us that they are pretty solid in terms of the mRNA vaccines that they have, and we are not hearing that they are looking for additional vaccines, including J&J.
And the last question I want to ask you about is, this is something that Cabinet has discussed a number of occasions. On August 9th, Canada is set to reopen the border to fully vaccinated Americans for non-essential travel. Given the change that we've seen in the case count in the United States, does Cabinet need to revisit this decision and have another conversation about whether it's really safe to proceed as per what the plan is?
Well, it's important to note that our discussions are ongoing about what is needed to keep Canadians healthy and safe. And at every turn, we are looking at the case numbers on both sides of the border. We are looking at the public health guidance and making the best decisions that are in Canadians' best interest. As Procurement Minister, what I've been trying to do is make sure we have the supplies in place, rapid tests and PPE and vaccines, so that Canadians have what they need to be safe and healthy in the months and years to come.
So so I'm clear, and this is my last question, I promise, just so that I am clear, you are comfortable with the decision as it stands to continue to allow fully vaccinated Americans to cross into Canada for non-essential travel purposes as of August 9th?
That decision has been made on the basis of public health advice, and we will continue to ensure that any of our decisions going forward are in the best interest of Canadians.
But you're comfortable with it as Minister of Procurement?
My role is procuring PPE, and I am comfortable with our government's stance on these matters. And as I said, should the situation change, we will, as a government, revisit any decision that doesn't make sense for Canadians. But at the current time, that's based on public health advice and following the lead of our health minister, as well as the other ministers at the table on this file.
Minister, thank you so much for your time today. I really appreciate it.
Thank you so much. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.